Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hello, everyone, and welcome to 5 to Thrive Live. I'm Karolyn Gazella, and I co-host this show with my good friend, Dr. Lise Alschuler. So periodically, I'm going to profile important herbs and nutrients on this podcast, starting with today's topic, saffron. I've become quite excited about this herb because of its mental health effects, but it has other benefits as well. And I have the perfect expert to help us understand saffron a lot better. Dr. Patricia Gaines is an herbal expert and naturopathic physician. She is also the chair of the Botanical Medicine Department and a supervising physician at Sonoran University Medical Center. But before we dig in, I'd like to thank our sponsors, beginning with Cetria, a patented form of glutathione, clinically proven to raise blood glutathione levels. Glutathione is the master antioxidant and the body's primary defense against free radicals. It also helps support respiratory health. For more information, visit cetriaglutathione.com. Also, Pro Thrivers Wellness Brain, a product specifically for thrivers that contains cognizin for memory, focus, and attention, as well as other brain-supporting nutrients and herbs. You can find Pro Thrivers Wellness Brain online at pureformulas.com. There's also Pro Thrivers Wellness Sleep, which combines higher dose melatonin and other sleep-supporting natural ingredients specifically designed for thrivers. You can find Pro Thrivers Wellness Sleep at pureformulas.com. And Dr. Ohhira's Probiotics, it's a best-selling probiotic for more than 30 years, and it contains 12 probiotic strains that are shelf-stable, so no refrigeration is required because of a unique 3-year fermentation process. It's a very effective probiotic. Learn more at DrOhhiraProbiotics.com. Dr. Gaines, thank you so much for joining me.
Well, it's a pleasure to be here talking about medicinal plants and saffron very specifically because it is an interesting plant for sure.
Yeah, I'm glad you were excited to talk about it because I got to pick the botanical, and I'm glad that you're just as excited as I am. So how do you describe saffron? Give us a quick overview before we dig into the details.
Sure. Well, it is a plant. It's a flowering plant. So it's a flower that probably most people are familiar with. Its Latin name is Crocus sativus, and it's grown from what's called a corm, which is a fleshy bulb. It's a pretty low growing plant, about maybe 12 inches with purple petals. And then it has these bright orange little thread-like structures that are actually the female reproductive parts of the plant called the stigma. And there's 3 per plant, so a very small amount, and these are hand harvested. So you can imagine that it takes a vast amount of saffron in order to accumulate any kind of amount of these thread-like structures. It does have a brilliant reddish orange color, so it's historically been used as a dye as well as a spice and for medicinal reasons. It's in the Iridaceae or the iris family. And there's just it's an ancient plant. There's a lot of modern research, but it's been around for a long time. And what's great about plants that have been used for so many thousands of years is that history gives us information not only about its safety, but it clues us into how it can be effective for us today.
Yeah, that's true. Are there specific regions where it's predominantly grown, or is it just basically all over?
No, actually, it is pretty specific. It tends to like a hot summer with like kind of a lower amount of rain and a cold winter. So Traditionally, the Middle East or Iran specifically is where the most amount of saffron is grown, but it has spread through ancient trade routes, and over time it's been grown in other places like India, Greece, Italy, and Spain as well. And in the United States, there are some newer places where people are growing it, like the Pacific Northwest. So what's great about that is this is a really expensive spice. It's the most expensive spice because there's just so little plant material from each flower. And so if there's a local place growing it, you can really feel confident if you go there and visit and then see how they're growing it, because there is adulteration because it's so expensive. So people can, manufacturers can sometimes add other things in it to bulk it up. And you want to really avoid that.
Yeah, for sure. Okay, so how can saffron benefit health? What are the main conditions that saffron can help with?
Well, I think if we understand the main things it does, that kind of underlies understanding the main conditions it treats. And it is a great antioxidant. It's an inflammation modulator, or most people understand anti-inflammatory, but it really modulates that inflammatory response. It has neuro or brain protective effects, and it's anxiolytic, or helps decrease anxiety and has a calming effect. So because of those things, it's been used in lots of conditions where you can understand that the mechanism of those other health conditions may be driven by inflammation or free radical damage. Things like depression, anxiety, insomnia, irritable bowel disease like ulcerative colitis and Crohn's disease, rheumatoid arthritis, cardiometabolic disease like hypertension and type 2 diabetes, Alzheimer's disease, ADHD, and PMS. So it's quite a varied list of conditions.
Yes, I'm quickly trying to jot down notes because that was a long list. Out of the list that you gave us, where is the research the strongest from your perspective as a doctor?
I think there is really good research, and it's interesting because this is a traditional use too, and sometimes like modern research doesn't necessarily align with traditional use of a plant, but it traditionally was used to improve mood, and I think there is really good research for its use in depression and anxiety. There also is research in Alzheimer's, which is kind of this emerging field of looking at alternative treatments for that condition. And I'm really interested in this research, which isn't robust as of yet, but using it for ADHD.
Ah, and what would the mechanism be for that? Is it the brain connection there?
Yeah, well, that's really interesting. And I don't know that we fully elucidated what is going on in terms of mechanism, but in research, what they've done is they've taken children and adolescents, and they've tested the conventional medication that's usually given, which is methylphenidate. And the brand name Ritalin is probably more common to people, but they've used saffron as a comparator to see how does saffron compare with methylphenidate. And what they found is that saffron is equally as effective as methylphenidate, and it actually outperformed that medication when it came to improving sleep latency, which is the time it takes from when you lay down to when you fall asleep, and also hyperactivity, which to me is amazing. It's something so simple with very few side effects that can have such a profound effect.
Yeah, and it's interesting to me as well because there's a nutrient that I just love called L-theanine.
Yes.
And because what you're describing with saffron is similar to L-theanine. L-theanine is great for anxiety, but it also helps with sleep. And some of the early research done was on young boys with ADHD, and it not only helped with their sleep, which often happens with ADHD, it also helped with the ADHD. So it seems like there might be similarities in how these two work on those particular conditions.
Yeah, that is really interesting. And something else that I find really kind of eye-opening and hopeful about this research with saffron and ADHD is that those patients taking methylphenidate often suffer from things like insomnia, decreased appetite, weight loss, and difficulty falling asleep. And those are things that saffron can help. And so a lot of times issues with side effects can be reasons patients don't continue taking a medication. And so maybe this is an alternative. But what they also found in the research is that the patients taking the methylphenidate and the saffron had a better outcome than those just taking methylphenidate alone.
Ah, interesting. So you can take it with that prescription. I'm fascinated by the Alzheimer's. Are you talking to reducing risk, or are you talking to help protect brain function once Alzheimer's has set in? Where on that continuum does saffron help based on the research?
Well, that's an interesting question. I was thinking about this a lot today, knowing we were going to be talking about this issue. And I think a lifetime of eating a diet that's chock full of antioxidants is one way we can protect ourselves from things like cancer and neurodegenerative disease. But we all have different exposures and different risk factors and different genetics that we inherit. And so I'd say one of the real benefits of saffron is that it is such a potent antioxidant and inflammation modulator. And part of the underlying mechanism with Alzheimer's is this inflammatory process. And so it can help with that, and it actually can improve activity of daily living and memory for those patients, but it doesn't reverse the disease process.
Okay, I see what you're saying. Before I leave these conditions, this long list of conditions, I want to talk a little bit about PMS because that one is kind of a flyer to me.
Yeah.
I can understand the antioxidant and the anti-inflammatory that's related to brain and mood and RA and irritable bowel diseases, et cetera, et cetera. What's the connection with PMS?
Yeah, that's really interesting. So it's helpful in PMS, especially if there's a depression component associated with that, which some women experience. So during that premenstrual period, that's usually a few days before the onset of menses, women can experience a variety of symptoms, but depressed mood can be one of them. And if that's the picture of that particular patient's PMS, and I think saffron could definitely be helpful.
Yeah, that makes a lot of sense. So what about dosage? Is the dosage because you've named a lot of different conditions here? Is the dosage just the same across the board, or does it vary by condition? What are we talking about in terms of how much people should take of saffron?
Good question. Well, in most of the research, it was dosed at 30 milligrams a day of an extract of saffron in divided dose. So it would be given, for instance, 15 milligrams twice a day, up to 100 milligrams a day, which isn't a huge amount. Studies have been somewhat limited in terms of duration, like most of the studies actually were around 4 to 12 weeks, but some of them are longer, like up to 26 weeks. So we don't have a lot of really long-term studies, but I think it's great that the therapeutic dose isn't super high like it is with some plants.
Well, that's great too because it's such an expensive botanical. So I would think that if
Right.
you had to take a lot, then boy, that could become problematic.
Absolutely. And something I do want to say too, because we're talking about lots of conditions, is that in the studies, it seems like in terms of depression, that saffron has a serotonergic type of effect, meaning it works a little bit like SSRIs do in that it seems to inhibit reuptake of that neurotransmitter. And what that means is that serotonin hangs out a little bit longer in that neuronal synapse and that it's available for use. So that's really interesting that we have a plant doing something that a medication is doing, but plants work in a really synergistic kind of way because they have lots of active compounds that work together.
Mm-hmm. Yeah. Um, so I was just wondering about saffron as well. When it comes to the research, do you have like a favorite study or a favorite group of studies that kind of caught your eye and that you'd like to share with us?
Well, I would say, and a student actually brought this to me in this research class that I teach about using saffron for ADHD. And I don't have a pediatric practice, so I don't see young children, but I was just blown away by the fact that the study showed that saffron was as effective as the medication for ADHD with fewer side effects. That to me was like, wow. First of all, it's just the potential is so big because so many children and adults as well have ADD or ADHD that something so simple as this one herb can have a profound effect on that.
Yeah, I love that. And then, like you said, not only kids but adults, and adults are being diagnosed as adults. It seems like more often as well. So I think that's a big one. I would agree. I think that's a big one. And then there again for the ADHD, it's that same dose of 30 milligrams a day divided up to 100 milligrams.
Yeah, I probably wouldn't go. I don't necessarily think you need to go up to 100 milligrams. I think people should start lower. Like saffron, for probably most of us, isn't a traditional part of our diet. So a lot of people have never even taken saffron. But I think 15 milligrams twice a day, especially if you're someone that doesn't weigh that much, like 150 pounds is kind of a typical gauge for what an average adult weighs when they talk about research or dosing of plants. That if you're, significantly under that, then I think 30 milligrams a day probably is about right.
Okay. So I would like to talk about safety and I want to talk about contraindications. If are there people who should not take saffron? Are there any side effects? Is it safe for children? Obviously, we're using this in children potentially with ADHD. So give me a good overview of the safety profile of saffron.
Yeah, these are the important questions, right?
Yes.
So it's not recommended for pregnant women. It is considered to be an emmenagogue, which means it can bring on menses. So it has a uterine stimulating effect. So in food doses as a spice, it's fine, but I wouldn't recommend a pregnant woman take capsules of saffron. And we don't have information about lactation. So usually when there's lack of information, we don't recommend that. Otherwise, it's considered really safe, and usually people don't have side effects, and there weren't a lot of side effects in the clinical trials. But the things that come up most often are decreased appetite, dry mouth, nausea, or headache. But that being said, those are not common side effects.
Okay. What about contraindications? I mean, you already mentioned that it can be used with ADHD medications. Are there any contraindications or people who should not use it other than people who are pregnant or lactating?
Well, yeah, there aren't any other across the board contraindications to using saffron, although it is possible that there are additive effects. And what that means is there are similar effects to using saffron with medications that can lower blood pressure or blood sugar. So if patients are on medications that have diabetes, elevated blood sugar, and they also take a medication in addition to saffron, that might have a strong effect at lowering blood sugar, and they need to check that. And the same is true for blood pressure because saffron has some antispasmodic activity that relaxes blood vessels and lowers blood pressure. So that's an additive effect. And it can be a little bit sedating in higher doses. So I wouldn't recommend using it with CNS suppressant type of sedative medications.
I see. We have a lot of people who listen to the show who have either had cancer or are actively going through cancer treatment. Can you talk to me a little bit about that patient population?
Um, Yeah, I think that just as an antioxidant in general, that's really beneficial for adjuvant care. And of course, if someone's going through chemotherapy, they always need to check how that chemotherapeutic agent is metabolized and whether or not it would be safe for them to take something else along with what they're doing. But saffron has like anti-proliferative and anti-adhesion and anti-migration effects. It can do so much to help protect cells. And in studies with cancer cell lines, it has been shown to increase sensitivity of certain cancer cells to chemotherapy while it spares the normal cells, which means it's specific treatment for some types of cancer cells. And that's great.
Yeah, it is. So I want to go back to something that you mentioned earlier. I almost wish I would have started with this because it's a very important point as we do these herb profiles moving forward. You mentioned that herbs work differently than
Mm.
pharmaceutical medications. Can you tell us a little bit more about that? Because that actually really gives us kind of a foundation of how herbs work, not just saffron, but just the herb category as a whole. Um, Take us through that a little bit. How are they different, and why is that important?
Yeah. Well, unlike medications, which are single agents that can go in a particular direction, like say they stimulate a particular pathway, plants have hundreds of different bioactive constituents that work synergistically together. And so you almost always, even though the research often isn't on whole plants, but you almost always get the best effect using medicinal plants when you use them in their complete bioactive profile, which means you use them as a whole plant. For instance, saffron is oftentimes standardized to the crocin content, but that's one compound. It's like taking, um, instead of taking turmeric, you're taking curcumin, which is one compound in turmeric. But turmeric, like saffron, has hundreds of therapeutically beneficial compounds that work together. And that's both the benefit and downside of plants in that we often don't know, or there isn't one active compound. There's lots of active compounds, which makes standardizing a challenge. And that's an issue in the industry that I think makes it hard for patients trying to get good quality plants because they're confused and it's confusing, like what testing is a company doing. But it also means that plants tend to work more slowly with your body instead of having such immediate and pronounced effects. And
Mhm.
that can be a great thing because it gives more margin for safety almost always.
Yeah, yeah, that's great. That's a great explanation. So, do you have any final thoughts you'd like to convey about saffron? Did we miss anything when it comes to saffron?
There's so much to say. I mean, you can talk about plants with a lot of research for, days because there's so much interesting research and so much to say. I don't think we talk much about its neuroprotective effects, but that's probably part of how it's really working in Alzheimer's and for folks that have um, increased risk for development of neurodegenerative disease. I think taking saffron um, just now every day would be a great thing for them to do.
Yeah, that's an important one, and especially as you age, and especially if there's any kind of family history of any kind of uh, brain disorder at all. So I think that's a really important application for sure.
Yeah.
All right. Well, this has been great, Dr. Gaines. I really appreciate you joining me. We'll have to have you back on. It's interesting because I love that I can tell that you get geeked out on herbs. Just
Totally.
yeah, I know. I know. Dr. Alschuler and I do
Totally.
too. Yeah, we really enjoy talking about herbs and botanicals and plants, and they're so complex and yet they're so powerful. So if you're receptive, I'll have you back on, and next time I'll let you pick the herb that you want to profile. It's going to be a tough choice, I think, for you.
That would be, yes, that would be fun. I just love talking about plants and I really appreciate the opportunity.
Yeah, it's great. Well, good. Well, thanks again, Dr. Gaines, for profiling saffron for us. I really appreciate it. And that wraps up this episode of 5 to Thrive Live. Once again, I'd like to thank our sponsors, ProThrivers Wellness Sleep Formula, ProThrivers Wellness Brain Formula, Cetria Glutathione, the superior glutathione to support liver and immune health, and Dr. Ohira's award-winning shelf-stable probiotic. Thank you for listening, and remember, you can find past shows at ithriveplan.com or wherever you listen to your favorite podcast. We are now on every single major podcast outlet out there. So look for us, just search 5 to Thrive Live, and you will find us, or go to ithriveplan.com. All right, everyone, may you experience joy, laughter, and love. It's time to thrive. Have a great night.